Hello everyone, my name is Sherifat Abdusalam. I'm here today to provide prenatal education on precautions to take during pregnancy. I'm wearing my school attire, my badge, no nail polish, no jewelry. I've verified my physician's order and I'm now going to the patient's room. Uh, Knock, enter the patient's room, provide privacy. I'm going to introduce myself to the patient, identify the patients with two identifiers, and then I'm going to perform hand hygiene, explain the reason for my visit, and then seek the patient's consent, which she has given. My patient's name is Mrs. Smith. Mrs. Smith, today I'm here to talk to you about precautions that you need to take during this pregnancy. I'm going to, as I've mentioned previously, we're going to have a lot of education during this pregnancy. I'm going to talk about foods that you need to avoid. I'm going to talk about over-the-counter medication. I'm also going to talk about exposures that you need to avoid, including alcohol, and some illicit drugs and tobacco. I'm also going to talk about precautions on traveling and your dental. First and foremost, remember that you are now eating for food. Raw, uncooked meat, such as poultry, seafood, meat, and egg should be avoided at this point in time because they contain bacteria that can be infectious to you and to the baby. You also want to avoid unpasteurized milk, including soft cheese, because all these ones can cause foodborne illness to you and your baby. Also, make sure you avoid fish that is high in mercury, such as swordfish, king mackerel, or even tilefish, because they can harm your baby's development of their nervous system. Also, caffeine should be taken in moderation. You should make sure caffeine at this point, your intake is below 200 milligram per day, or you may not even take it at all during this period, because high level of caffeine in the body is linked to miscarriages and low birth weight for the baby. Secondly, the over-the-counter medications that we call OTC. I want to talk about Tylenol especially. When Tylenol is ordered by your doctor, that means it's safe to take. But then, because you have access to it over the counter, ensure that you don't go above what the doctor has recommended. You also want to avoid medications like ibuprofen, naproxen, or NSAIDs like aspirin, especially in your third trimester, because they can increase your risk of circulation. It can also reduce your amniotic fluid, and then it can also cause some other complications that can come in from using too much of this medication. Aspirin especially should be avoided during your pregnancy except it is prescribed. Even though there's going to be heartburn during this pregnancy, you want to make sure the heartburn medication you're taking contains calcium carbonate like Tums. You don't want to do other heartburn medications that might have complications for you. And then if you have nasal issues like nasal congestion, remember to take saline sprays, because you don't want to take sprays that will now cause more complications to your congestion. Prenatal vitamins, though it is ideal for you, you want to make sure you take the one that's the once daily prenatal, and you want to make sure you take the one that is recommended by your physicians. Try to avoid so many different makes of prenatal vitamins that might arise in complications for you. Make sure the prenatal vitamin you're getting is rich in folic acid, because folic acid, iron, calcium, and other essential nutrients, because they're going to help your fetus development. Remember to use herbal supplements in moderation, because they have not been proven to be safe in pregnancy, even though people use it. Just make sure you use them in moderation and with caution. Avoid a large amount of vitamin A as well, because if it's in high quantity, vitamin A can lead to birth defects. So remember all this when you're getting your over-the-counter medication. The third thing I want to talk to you about is exposures that you have to avoid. Cat litter is one of the exposures you should do as much as possible to avoid, because cat litters, which we find in cat feces, has a toxo toxoplasma gondii, which can cause toxoplasmosis, and this can actually cause a lot of defect to your fetus. You want to make sure if you're handling it, you're wearing gloves, and when you're done, you're washing your hand thoroughly when you're done, because you don't want to come in contact with it. If possible, avoid touching cat litter at this present in time during your pregnancy. So make sure you don't do that. Also, you want to avoid pesticide and insecticides at this problem, because they are going to impact your fetus development and growth if you come in contact unnecessarily with them. So try to be conscious when you're doing that. Lead is another thing you should be mindful of. Most building paints and all that have lead in them, so make sure whatever you're doing, you avoid old buildings or places where they have signs saying lead is there. Make sure you don't, because it can affect the development of your baby's brain and the nervous system. So make sure you don't do that. And then also remember strong cleaning materials like solvents, all those soaps. Make sure those chemicals are seriously avoided, because they can actually cause harm to the baby. Also remember, excessive heat from hot tub is also harmful to your child. So try to avoid dipping yourself in hot tub or the sauna. Try to avoid it so that it doesn't harm your fetus. The other thing I also want to talk about now is the alcohol, tobacco, and substance use. Consuming alcohol should not even be talked about during this period. So try as much as possible to avoid alcohol, because it can cause actual spectrum disorder, which means there's so many complications that can arise from withdrawal symptom, fetus development issues, growth development issues. A child might not even be able to reach their milestone because of alcohol consumption. So I will say that you should try as much as possible to avoid alcohol, because it's easy for it to cross the placenta to the unborn baby and cause some developmental delays and birth defect. The other thing you should avoid is tobacco, nicotine, and like cigarettes, like vaping. All the smokeless cigars, you want to make sure you avoid them, because they are easily transferable to the placenta and can cause preterm delivery, as well as miscarriages or complications during pregnancy. Even it can also cause low birth weight for the baby, or sudden infant death syndrome. You also want to be mindful of illicit drug consumption, because those ones can cause birth defect. They can cause developmental delays. They can cause long-term developmental delays, like I said, or even death to your unborn child and withdrawal symptoms. So you want to make sure you avoid that. The other thing I want to talk about is traveling. During this time, around second trimester, which is 14 to 28 weeks, it's ideal to travel, but you want to do that with some caution. Nausea is stop, but then when you travel, you might experience seasickness, hair sickness that will bring back the nausea. So you want to make sure you talk to your doctor before traveling. You want to make sure you have all your prenatal appointments before you travel. You want to ensure that where you're going to, they have emergency services available, maternity homes available that you can go to continue with your treatment. Make sure when you travel, you take all your medications along. You take all your medical history, especially your during your prenatal period. You want to make sure you take them along whenever you travel, because you don't know whatever medical issues can arise during that period. You also want to avoid areas where there is disease outbreak or war outbreak. You want to make sure your location is safe. You want to make sure there is no emergency and obstetric service, like I mentioned, is available. You want to also remember that when you're traveling, you might have to sit down for long. Deep vein thrombosis is very common when you sit for long, so make sure you're walking at least 1 2 hours or moving around, and you're staying hydrated. Take a lot of water so that it can break down all those blood clots in your body. You also want to make sure you change your sitting position, so that way you can have adequate blood flow in your body. Also, make sure you don't wear tight clothing during this trips, so that, for me, everything is about circulation. There has to be a flow. So remember, no tight clothing, and if possible, get your doctor to prescribe you a compression stocking so that you can wear that and ensure that there is enough flow going around your body. Lastly, I'm going to talk about your dental. Second trimester is ideal. Like, we've skipped all the danger zone as it is technically, but this is the time that you can go for your dental visit. Remember that nausea and vomiting, it comes with a lot of stomach acid that will have caused some erosion to your teeth, some erosion to your enamel. You want to make sure you get enough dental cleaning. You want to make sure you're flossing, you're washing your teeth. You want to be cautious of that. You also want to make sure there is regular checkup going on with your teeth. During pregnancy, it's confirmed that a lot of women experience gingivitis, so make sure there is adequate dental hygiene during that period. And then, if you're going to go for that visit, ensure that your dentist is using proper shielding before you do your x-ray, because you don't want anything that is going to affect your fetus. So make sure they have proper shield in place to protect you. Let them know you're pregnant, so they protect, everything they do it with the cautiousness that they're doing it for you and your baby, so that there is enough and adequate protection. Remember to do your dental cleaning. Remember to ensure you notify your physician during any travel during pregnancy. Make sure you avoid alcohol, tobacco, or illicit substances. Ensure you avoid toxins, especially cat litter. Ensure you avoid that. Remember, OTC medications, not all of them are safe. So just be mindful of what you're consuming over the counter, and also try to avoid certain food that will be detrimental to you and your baby. Do you have any question for me? Yes, I understand it's a lot to take in, but if you need more information, I'm here for you. Our patient said she's okay, no issues. I'm going to ensure my patient is in a comfortable position. There are no issues. Then I'm going to leave the room, provide privacy, perform hand hygiene, and then document. Thank you.